Hello everyone. The next topic which we will be discussing here is about the autoimmune hepatitis. So what is this disease? This is a disease which leads to the liver inflammation. So what this disease leads to the liver inflammation that occurs when your own body immune system turns against the liver cells. So this is what the autoimmune, in which the body's immune system will attack its own liver. Now let's discuss it further, that this disease is chronic in nature. Chronic, which means it lasts for about many years. There are two terms which are there. So first is the acute and the second is the chronic. So in case of acute, it lasts only for a short period of time, but in case of chronic, it lasts for a long period of time. So this is what the chronic means. And if this type of disease left untreated, it leads to the liver failure or cirrhosis. Now, autoimmune hepatitis is a liver inflammation that occurs when your body's immune system turns against the liver cells. The exact cause is still not known because the scientists are working on it and the exact cause is not known. But there are several genetic and environmental factors that appear to interact over time in triggering the disease. And untreated autoimmune hepatitis can lead to scarring of the liver and even actually leads to the liver failure. So when there is a diagnosis of this type of disease and they are treated at early, so autoimmune hepatitis often can be controlled with drugs that suppress the immune system. So the if at an early stage it is diagnosed and treated, it can be treated with drugs. Next is the figure which is being representing here, that in a healthy liver cell, you can see there is no inflammation. The immune cells, they attack the harmful bacteria or viruses and other toxins and the foreign materials. And the liver is looking normal in this case. But in case of autoimmune diseases, what is happening? There is an inflammation of liver. There are autoantibodies. So the body's immune system is attacking its own liver cell. So their white blood cells, they attack the liver cells. So this is what the inflammation of the liver takes place. So this is a kind of autoimmune hepatitis in which the body's immune system is attacking its own liver cells. So the symptoms of this disease. There are signs and symptoms of autoimmune hepatitis which can vary from person to person and may come on suddenly. So some people have few, if any, recognized problems in early stages of the disease. Others experience signs and symptoms that may include, what are the symptoms that are included? They are fatigue, then there is abdominal discomfort, there is a yellowing of the skin and white of the eyes that leads to jaundice also. Then there is an enlarged liver, there is abnormal vessels on the skin, there are skin rashes all over the skin, there will be joint pains, and in females especially it will lead to the loss of the menstrual periods. So these are some of the autoimmune hepatitis symptoms. Now, what can be the causes? So, the causes are, so when the body's immune system ordinarily attack the bacteria and virus and other pathogen instead of the targets the liver, this attack on your liver can lead to chronic inflammation and it can cause the serious damage to the liver cells. And the body turns against itself is unclear, but the researchers, they think that autoimmune hepatitis could be caused by the interaction of the genes which is controlling the immune system function and exposure to the particular viruses or drugs. So the cause is still not known, that what can be the cause, but the scientists, they're still working on this part. Now, there are two types of autoimmune hepatitis. The first is the type 1 and the second is the type 2. So what is type 1 autoimmune hepatitis? So this is the most common type of disease. So what is it? It is the most common type. So it is the most common type of the disease. It can occur at any age. So it can occur at any age. And about half the people with type 1 autoimmune hepatitis have other autoimmune disorders as well. So the other autoimmune disorders will include the celiac disease, which will include it is a disease which is caused by the wheat. The person will have the allergy from the wheat. Then the arthritis or ulcerative. So these are some of the common autoimmune diseases which the person is already having, and they are also having the type 1 autoimmune hepatitis. Next comes is the type 2 autoimmune hepatitis. So although adults can develop type 2 autoimmune hepatitis, it's common in children. So it is most common in the children and young people. Children and young people, this type of disease is more common. And other autoimmune diseases may accompany this type of autoimmune hepatitis as well. Now, this was about the types. Next comes the risk factors. So, factors that may increase your risk of autoimmune hepatitis includes the being a female. What that means is, although both the males and the females can develop the autoimmune hepatitis, but the disease, it is more common in the females. Then, a history of certain infections. So autoimmune hepatitis may develop after you are infected with what kind of diseases? After you are infected with the herpes, measles, and other kinds of diseases. So this is also linked to hepatitis A, B, and C infection as well. Next comes is the hereditary. So the evidence suggests that a predisposition to autoimmune hepatitis may run in the family. So it may be genetic in nature. So they can be run in the families as well. Then having an autoimmune disorder, a disease. So the people who already have an autoimmune disease, as discussed in the previous slide as well, for example, they may having a celiac disease or the uh, arthritis, hyperthyroidism, they may likely to be more infected with the autoimmune hepatitis. So these are some of the risk factors. Next comes the complications. Although autoimmune hepatitis that goes untreated can cause permanent scarring of the liver tissue. So there are some of the complications which include the enlarged veins in your esophagus. Esophagus means in your food pipe. So when circulation through the portal vein is blocked, blood may back into other blood vessels, and mainly those into your stomach and esophagus. So the blood vessels are thin walled, and because they are filled with more blood than they are meant to carry, they are likely to bleed. So there is a massive bleeding in the esophagus or stomach from these blood vessels, and it is a life-threatening emergency that requires immediate medical care. So it can be a life-threatening and leads to the immediate care. It's a life-threatening emergency. Next comes the fluid in your abdomen. So liver disease can cause large amounts of fluids to accumulate in your abdomen. So these ascites, they can be uncomfortable and may interfere with breathing and is usually a sign of advanced cirrhosis. Next comes the liver failure. So this occurs when there is an extensive damage to liver cells, and it makes it impossible for your liver to function adequately. So at this point of time, a liver transplant is needed. So in this case, whenever there is a liver failure, the liver transplant is being needed. Next comes the liver cancer. So people with disease cirrhosis have an increased risk of liver cancer as well. So this was all about the autoimmune hepatitis. These are some of the references.